So hi, my name is Jhessie.
I'm Beverly Talania.
Hi, my name is Lucy.
Hi, my name is Brenda.
For our presentation, we decided to do the cardiovascular system, also known as the circulatory system, which consists of the heart and the blood vessels.
And the function of this body system is to carry blood away from and towards the heart.
This allows for the circulation of oxygen, nutrients, and hormones to the cells of our body.
In addition to providing the necessary components to keep us alive, it also removes waste products like carbon dioxide through gas exchange within the lungs.
The first component of the cardiovascular system is the heart. The heart is a fist-sized organ that functions in the pumping of blood throughout the body. There are two sides of the heart, the left and right, and they work together simultaneously. On the right side of the heart, blood enters through the superior and inferior vena cava, emptying deoxygenated blood from the body into the right atrium of the heart. As the right atrium contracts, blood moves from the right atrium into the right ventricle through the open tricuspid valve. As for the right ventricle gets full, the tricuspid valve shuts, which prevents blood from moving backwards into the atria. As the right ventricle contracts, blood leaves the right ventricle through the pulmonary valve into the left and right pulmonary artery, which then goes to the lungs where CO2 is exchanged for O2. After gas exchange occurs, the blood is then returned to the heart by the left and right pulmonary veins. As for the left side of the heart, as we get the now oxygenated blood from the left and right pulmonary veins, it is emptied to the left atrium of the heart. As the atrium contracts, blood flows from the left atrium into the left ventricle through the open mitral valve. As the ventricle fills up, the mitral valve closes, allowing the ventricle to contract, which then moves the blood through the aortic valve and into the aorta, where it leaves the heart and goes throughout the body. The next component of the cardiovascular system is the blood vessels. We have three types of blood vessels, which are the arteries, capillaries, and veins. The arteries are the large blood vessels that carry blood away from the heart to other body organs. Tiny arteries are called arterioles. The capillaries are the smallest type of blood vessels, and this is where oxygen leaves the blood and enters the cell. And lastly, veins are thin-walled blood vessels that carry blood back to the heart, and tiny veins are called venules. With all the knowledge of the different components of the cardiovascular system, we should talk about how the blood is circulated within the body. We have two types of circulation. We have pulmonary circulation, and then we have systemic circulation. Pulmonary circulation is the circulation of blood that goes through the blood vessels from the heart to the lungs, and vice versa. In this circulation, this is where gas exchange occurs. The pathway of this was previously explained in the previous slide, where it starts from the right side of the heart to the left side of the heart. Whereas systemic circulation is the pathway of blood from the heart to tissue capillaries and back to the heart. This starts with oxygenated blood from the aorta and ends with deoxygenated blood in the vena cava.
Our group chose to focus on hypertension. Hypertension is a condition in which the force of blood against artery walls is too high within the heart. Many things can cause hypertension, such as the lack of physical activity, older age, being overweight or obese, race. For example, non-Hispanic and Black people are more likely to have a high blood pressure than people of other races. Some birth control medicines, stress, tobacco use, or drinking too much alcohol. Healthcare providers involved may be primary doctors, cardiologists, dietitians, and physical trainers. A primary doctor may diagnose a problem by asking questions such as the family medical history. The doctor may also pay more attention if the patient has kidney or hormone problems, diabetes, and high cholesterol. A cardiologist specializes in the heart and blood vessels, therefore will be able to monitor blood pressure more closely. A dietitian is crucial for people with hypertension because they will be limited from certain foods that may be harmful. A dietitian will check for salt, fat, and cholesterol levels within the foods. A physical trainer is also very crucial, as they may be a guide for someone with high blood pressure and will help them exercise daily in order to keep their pressure under control.
To measure your blood pressure, you will undergo a procedure called a blood pressure test. This measures the pressure in your arteries as your heart pumps. To perform this test, you will need the following medical equipment: a sphygmomanometer, which consists of an inflatable cuff, and a stethoscope for a manual measurement. This is a quick process in which it is done in a sitting position with your arm at the level of your heart. An inflatable cuff is wrapped around your upper arm. This test is done in two ways. For a manual measurement, a stethoscope is placed over the major artery in your upper arm, your brachial artery, to listen to your blood flow. A cuff is inflated with a small hand pump. As the cuff is distended, the blood flow through the artery will stop. Then a nurse will gradually release the air to restore the blood flow by opening the valve on the hand pump. Then he or she will record your blood pressure. Your blood pressure can also be measured automatically, a digital sphygmomanometer. In this case, a stethoscope is not required. A blood pressure measurement has two numbers. The top number is the systolic, which is the pressure of the blood flow when your heart muscle contracts to pump blood. The bottom number is the diastolic, which is the pressure measured between heartbeats. Let's take a look at what they mean. If your systolic is below 90 and your diastolic is below 60, that means that you have a low blood pressure or hypotension. If your systolic is less than 120 and diastolic is below 80, it means that you have a normal blood pressure. But if your systolic measures higher than 130 to 139 and diastolic is 80 to 89, that means that you have a stage 1 hypertension. And if your systolic reads 140 and more and diastolic is 90 and more, that means that you have a stage 2 hypertension. Your doctor will perform this test 2 to 3 times at 3 or more separate appointments before diagnosing you with hypertension. If you are diagnosed with any kind of high blood pressure, your doctor may order a urinalysis to screen for causes of stage 2 hypertension and to check for kidney damage caused by untreated hypertension, blood tests to determine your cholesterol level, and electrocardiogram to measure your heart's electrical activity. If necessary, your doctor will require an echocardiogram to look for more signs of heart disease. In this case, a transducer and echocardiography are needed to perform this test. Your doctor may prescribe medications to lower your blood pressure. Some medications, such as thiazide diuretics. Diuretics, sometimes called water pills, are medications that act on your kidney to help your body remove sodium and water, decreasing blood volume. This is just one of the many medications prescribed to help with hypertension. However, if your blood pressure remains high despite taking 3 different drugs, you may have a resistant hypertension. In this case, you may undergo some invasive treatment for hypertension. An example is balloon angioplasty. This helps with the condition, but it does not yield better results over the long term and may increase the incidence of aneurysm formation.
The exact causes of high blood pressure are not known, but several things may play a role. In addition to the list Brenda mentioned, these factors also contribute to the cause of hypertension. Too much salt in the diet, stress, genetics, family history of high blood pressure, chronic kidney disease, adrenal and thyroid disorders, and sleep apnea. One can have high blood pressure for years without any symptoms. Even without symptoms, damage to blood vessels and your heart continues and can be detected. Uncontrolled high blood pressure can increase your risk of serious health problems, including heart attack and stroke. High blood pressure generally develops over many years, and unfortunately, it affects nearly everyone. A few people with high blood pressure may have headaches, shortness of breath, or nosebleeds, but these signs and symptoms aren't specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. By living a healthy lifestyle, you can keep your blood pressure in a healthy range. Practicing the following healthy living habits can prevent high blood pressure. Eat a healthy diet. Be sure to eat plenty of fresh fruits and vegetables and foods rich in potassium, fiber, and protein, and lower in sodium and saturated fats. Keep yourself at a healthy weight. The more you weigh, the more blood flow you need to supply oxygen and nutrients to your tissues. As the volume of blood circulated through your blood vessels increases, so does the pressure inside your arteries. Be physically active. Exercise increases blood flow through all arteries of the body, which leads to the release of natural hormones and cytokines that relax blood vessels, which in turn lower blood pressure. Do not smoke. Smoking raises your blood pressure and puts you at a higher risk for heart attack and stroke. Limit how much alcohol you drink. Men should have no more than 2 alcoholic drinks per day, and women should have no more than 1 alcoholic drink per day. Having a healthy diet is key to preventing high blood pressure. A diet that has been found to be helpful for those with hypertension and for those who want to prevent it is the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. The DASH diet encourages the reduction of sodium in your diet and eating a variety of foods rich in nutrients that help lower blood pressure, such as potassium, calcium, and magnesium. These foods include vegetables, fruits, and low-fat dairy foods, and moderate amounts of whole grains, fish, poultry, and nuts. Let's take a look at the recommended servings from each food group. For grains, it is recommended to have 6 to 8 servings a day. Grains include bread, cereal, rice, and pasta. For fruits and vegetables, it is recommended to have 4 to 5 servings a day. For dairy, it is recommended to have 2 to 3 servings a day. Milk, yogurt, cheese, and other dairy products are major sources of calcium, vitamin D, and protein. The key to eating dairy while keeping it healthy is to make sure that you choose dairy products that are low fat or fat-free, because otherwise they can be a major source of fat. For protein, it is recommended to have 6 1-ounce servings or fewer a day. Some options are lean meat, poultry, and fish. For nuts, seeds, and lug mix, it is recommended about 4 to 5 servings a week. Almonds, sunflower seeds, kidney beans, peas, lentils, and other foods in this family are a good source of magnesium, potassium, and protein. For fats, it is recommended to have 2 to 3 servings a day. Fat helps your body absorb essential vitamins and helps your body's immune system, but too much fat increases your risk of heart disease, diabetes, and obesity. For sweets, it is recommended 5 servings or fewer a week. When you eat sweets, choose those that are fat-free or low-fat. Cut back on added sugar that has no nutritional value. By making lifestyle changes such as modifying your diet, exercising, stopping smoking, and losing excess weight, you can help lower your blood pressure and avoid the complications such as kidney disease, eye disease, and heart disease.
Other systems that are affected by high blood pressure are the nervous nervous system, and the urinary system, which will affect the brain and the kidneys. These are the main targets of elevated blood pressure because these organs take up a large share of the circulating blood. Uncontrolled hypertension accelerates the damage to these organs and results in eventual organ failure and cardiovascular death and disability. People should be aware of the causes of hypertension, that way damage to the heart and other parts of the body can be prevented. It is important that people try to educate themselves and others about hypertension since it is very common and a silent killer. Many people show no symptoms of hypertension. High blood pressure increases the risk for heart disease and stroke. These are the two leading causes of death for Americans. Tens of millions of adults in the United States have high blood pressure, but they do not have it under control.
So we hope that this video has helped you understand a little bit more about your cardiovascular system
and help give a glimpse of what diseases may arise if you don't take care of yourself.
So to limit your risk in developing hypertension,
We recommend that you be active, eat healthy, and stay safe.